Good day, everyone. Thank you for joining this online session. My name is SHOBHANAMBIGHA SIVAGURU from Polytechnic Balik Pulau, Malaysia. Today, I will be presenting a case-based study entitled Implementation of Thought Record Technique on Low Self-Esteem in a Bulimic Adult. This presentation shares findings from a single subject intervention using a cognitive behavioral therapy technique, specifically the thought record technique, to address low self-esteem among individuals diagnosed with bulimia nervosa. The background of study. In recent years, body image pressure among young adults has intensified, particularly with the increasing influences of social media and unrealistic beauty standards. Thinness is often equated with beauty, self-worth, and social acceptance. As a result, many young adults develop unhealthy eating patterns, including bulimia nervosa. Research consistently shows that bulimia is strongly associated with low self-esteem, harsh self-criticism, and distorted self-evaluation. In Malaysia, however, empirical and case-based intervention studies focusing on psychological treatment for bulimia remain limited. This gap highlights the need for structured therapeutic approaches that address not only eating behavior but also the underlying cognitive and emotional components. Bulimic adults often experience persistent low self-esteem that is deeply rooted in negative core belief about the self. These beliefs reinforce maladaptive behavior such as binging and purging. Interventions that focus solely on eating behavior may not sufficiently address this underlying cognitive pattern. Additionally, there is a lack of Malaysian case-based research examining the effectiveness of cognitive-based behavioral therapy technique, particularly the thought record intervention in treating low self-esteem among bulimic individuals. The study was conducted with three main objectives. First, to identify the level of self-esteem in a bulimic adult. Second, to explore the emotional, behavioral, and cognitive symptoms experienced by the participant. And third, to examine the effectiveness of the thought record technique in improving self-esteem and psychological functioning. Let me explain about cognitive behavioral therapy that was developed by Aaron Beck. CBT, let's just call it CBT. CBT emphasizes the interaction between thought, emotion, and behavior. According to this approach, maladaptive core beliefs and automatic negative thoughts contribute significantly to emotional distress and dysfunctional behavior. The thought record technique is apart from CBT. It helps clients to identify automatic negative thoughts, examining the evidence for it, and fight against these thoughts, and to generate more balanced and realistic alternatives. Through repeated practice, clients learn cognitive restructuring, which promotes emotional regulation and behavioral change. This technique is widely recognized as evidence-based for various emotional and eating-related disorders. This study employed a mixed method single subject case study design. An A-B design was used, consisting of a baseline phase followed by an intervention phase. The intervention was conducted across 6 counseling sessions, allowing both quantitative measurement and qualitative observation. Data triangulation was achieved through standardized scales, session transcripts, and clinical observations. Participant and sampling. The participant was a 21-year-old female college student diagnosed with bulimia nervosa. She was selected using purposive sampling from a group of 8 students who were screened for eating-related concern. These participants demonstrated prominent symptoms of low self-esteem, self-criticism, and maladaptive coping strategies. Several instruments were used in this study. We used the Rosenberg Self-Esteem Scale, or RSES, to measure the changes in self-esteem, And in addition, counseling session transcripts and mental status examination findings were used to capture emotional, cognitive, and behavioral changes throughout the intervention. The procedure. The procedure begins with three baseline RSES measurements to establish the participant's initial level of self-esteem. Following this, the thought record technique was introduced during the counseling sessions. The participant was given homework assignments to practice identifying and restructuring negative thoughts in daily situations. Continuous observations and transcript analysis were conducted throughout the intervention period. So this actually allows, we give homework for the participant to practice, for them to do it at home, and for them to practice changing their mindset also. So the RSES score trend. This slide illustrates the trend of the participants' RSES scores across baseline when it started and the intervention phases. During the baseline, self-esteem scores remained consistently low. After the introduction, after we started introducing the thought record technique in the counseling session, a clear upward trend was observed, indicating improvement in self-esteem over the sixth counseling session. This quantitative change suggests that cognitive restructuring contributed positively to the participants' self-perception. P&D analysis. Percentage of non-overlapping data, or P&D, was used to evaluate intervention effectiveness. The highest baseline score was 12, while treatment scores increased to 15 and 24. This resulted in a P&D value of 67%, which is interpreted as moderately effective intervention. This finding supports the effectiveness of the thought record technique in improving self-esteem within this case. Let's look at the qualitative finding. Qualitative analysis revealed meaningful changes across emotional, cognitive, and behavioral domains. Emotionally, the participant reported reduced guilt, fear, and anger. Cognitively, there was a noticeable reduction in rigid self-criticism and negative core belief. Behaviorally, purging behaviors decreased, and the participant demonstrated improved insight and judgment regarding her condition. Let's look at the effectiveness of thought record technique. Overall, the thought record technique increased the participants' awareness of negative automatic thoughts. It improved cognitive flexibility and supported gradual behavioral change. The participant also demonstrated increased self-control and confidence. While I was conducting the counseling session, I could observe the participant's self-confidence increasing from her behavior, from the way she's talking and all, indicating meaningful psychological growth over time. The implication of this study. The findings suggest that the thought record technique is a practical and effective tool for counselors in handling or tackling people with bulimia nervosa. It can be applied in both counseling and medical settings and supports early psychological intervention. Additionally, this technique may be useful in counselor training programs also, particularly for treating eating-related disorders. Limitations and future research. This study is limited in the sense by its single subject design and a very short intervention period. It was only six weeks. The reason for such a short intervention duration because it was a short semester, so the student could only be there for 6 weeks. So that's the reason it had a short intervention duration. As such, the findings have limited generalize it, it's very limited. Future research is recommended to include larger samples, longer intervention periods, and controlled design to strengthen the empirical support. In conclusion, The thought record technique was found to be effective in improving self-esteem and reducing symptoms associated with low self-worth. The intervention also supported a reduction in bulimic behaviors. Overall, this study highlights the potential of CBT-based techniques as promising interventions for individuals with bulimia nervosa. Thank you very much for your attention. If you have further questions or would you like to discuss this study further, please feel free to contact me. Okay, I can be contacted at shobhanambigha@pbu.edu.my. Let us continue to share knowledge, support one another, and work together towards better mental health intervention. Thank you.